Allergies to nuts and shellfish are very common, and if you have one, you likely know it and know how to avoid it. But despite how careful you might be with the foods you're allergic to, it is possible that you're still consuming foods that your body is sensitive to in other ways. SSM Health family medicine physician and wellness coach Dr. Roopa Shah explains the difference between a food allergy and a food sensitivity. Now, this is really important. So let's start with what the difference is between a food allergy and a food sensitivity.
Yeah, so food allergies tend to be, obviously as they sound, more severe than a food sensitivity. They come on quicker. You can have lip swelling, tongue swelling, difficulty swallowing. You could have hives, difficulty breathing. So these are really severe, symptoms when we're talking about food allergies. Food sensitivities, they come on later, maybe even 72 hours later. A lot more to do with gas, bloating, maybe some discomfort. Some people can present with migraines, headaches, maybe some like rashes around the mouth, but not the more severe symptoms that you get with a true food allergy.
Right, and if you have an allergy, like we said, you probably know it, but it's that sensitivity that could maybe surprise you a little bit.
Yes, definitely.
Now, what are some of the symptoms of both allergies and sensitivities?
Yeah, so again, an allergy, you're going to have maybe difficulty breathing, hives, throat swelling, and that's really a true medical emergency. So if that's happening, you should be reaching for an EpiPen if you have one, or definitely getting yourself to an urgent care or an emergency room. Food sensitivities, again, people can have rashes, they can have an upset stomach, migraine headaches. So it's going to be things that you feel unwell and you can't put your finger on it until you really start doing a food diary to see what are the foods that I've been consuming that could be contributing to these overall symptoms.
Yeah, you got to keep track of those things, especially if if you think there's a trend. Now, what are the most common foods that can cause a sensitivity? I think one that a lot of people are dealing with now, that gluten, you know, lots of gluten is causing issues for a lot of folks.
Gluten is a very common one. Truly, if you're allergic to it, you're going to have a celiac disease, which in and of itself is a true, kind of autoimmune process. But having a sensitivity to gluten, you could have some of those same symptoms like diarrhea, loose stools, stomach pains, things like that. But other foods that can cause issues are dairy. Lots of folks have lactose intolerance. Soy is another big one. Egg. So if you feel like you're having some issues with these foods, first you have to determine by talking to your physician, do you need to see an allergist who can test you for true food allergies versus maybe do you need to see a gastroenterologist who really specializes more in food sensitivities, celiac disease, those types of things.
Yeah, and it's unfortunate. These are a lot of common foods, dairy, eggs, bread, and also, delicious foods as well, but important to know what you're sensitive to.
And sometimes you can even talk to your physician to try and do an elimination type of diet to start eliminating foods that you think might be the culprit in order to better figure out what it is.
Lots of good substitutes out there nowadays as well. Dr. Shah, where else can people find you?
They can find me on Instagram at Wellness with Dr. Shah.
All right, thank you as always.
Thank you.